There we go. Yeah, so I'm not sure how many. I have a feeling that there's quite a few people here who are homeopaths or homeopathic students. And I think for most of you, this will be quite elementary, to be honest. This is really designed for people with very little experience of homeopathy or really just want to treat their families safely and effectively. So that's the aim of this little presentation. It'll probably take about half an hour, something like that. So it won't be too long, won't keep you from your dinner. It's about, what time is it here? It's 6:05 in the UK, and I'm hoping we've got lots of people from all over the world. So welcome to everybody. So let's just dive in. Let's have a start with looking at what hay fever is, shall we? Just in case anyone is in any doubt. So these are the common symptoms of hay fever. Let's have a look at them. So we've got, yeah, tiredness is one that's quite common. Headache, especially in the temples and forehead. Some people experience earache. Not everyone. A lot of people experience loss of smell, and sneezing and coughing is quite common, obviously. And then itchy, red, or watery eyes is very, very common. And then, of course, a runny or blocked nose. It's all very uncomfortable. I'm quite fortunate that I don't suffer from hay fever. But I know I see, obviously, I see people as we come into the hay fever season all the time, and it's really miserable for a lot of them. And then people are resorting to antihistamines and all kinds of drugs to sort of to kind of ease it off a little bit. But it's difficult to treat. I mean, it's the conventional stuff is kind of a bit like using a sort of sledgehammer, really, to sort of knock it out. Homeopathy is much more subtle, and I think it's more effective, actually. If you get the right remedy, it's more effective. So um, these are the typical seasonal elements. So early on, from sort of late March, so we're in the middle of this, you tend to get tree pollens, and that this goes on till mid-May, and then uh, from mid-May until July, we tend to go into the grasses, and then the late season is sort of more weeds, like the sort of weeds you find on the roadside, of course, or in your gardens. So those are typical hay fever symptoms. If you've got any questions, by the way, feel free to. I don't want this just to be like a lecture. It's interactive. So if you've got any questions or even comments, pop them in the chat box, and I'll try and answer those. And if you feel very brave, you can even come on, live and say your piece. So feel free to do that. Okay. Um, So now this is for people who are really not very familiar with homeopathy. With conventional drugs and conventional medicine, it actually seems very simple. You go to the doctor and they say you've got hay fever, right? You need an antihistamine, and then it's a very easy, you've got this. Uh, I'll give you a drug that will combat that. So that just seems very, very simple. Unfortunately, because it's basically medicine for the masses. So it's designed to treat a sort of it's called broad spectrum. It's designed to treat a large number of people with kind of roughly similar symptoms, but it doesn't individualize at all. And in homeopathy, where we kind of win is because we do individualize the each case. So one person's hay fever will be completely different from our point of view to another person's hay fever. If you turn off your video camera, turn and mute yourself, that would be great. Thank you. It just was a bit distracting. Um, so in homeopathy, we it's all about individualizing the case in front of you, the person in front of you. And then we find we get very, very good results, better results, I would say, than with conventional drugs, which is good to hear. So we have this concept of the strange, rare, and peculiar. I once thought about having a T-shirt with "I'm strange, rare, and peculiar" on it, but I decided not to do that in the end. But the strange, rare, and peculiar is basically, as it says, striking, an exceptional, or an unusual, or an oddly characteristic symptom. It's something that, like you see somebody in the street and something, it may be even difficult to put your finger on what is individualized about them, what is specifically different about them from the person standing next to them. And so that's what we're looking for. We're looking for those sort of things which characterizes someone's symptoms, and even characterizes their personality. We're sort of interested in a person's disposition or a person's personality. That also comes into treatment with homeopathy. And so it makes it actually quite fun, because you're sort of looking for archetypes and sort of characters. It becomes a little bit psychological. So allergies. Homeopathy treats each person as unique. We've said that. And remedies are chosen based on the individual's specific symptoms, triggers, and overall health. And I cannot emphasize that enough, because it is such a different way of thinking about health. We're so used to having a silver bullet that can, you just go, you got hay fever, you go and get the hay fever drug, the antihistamine or whatever it is. And it was so used to that sort of way of thinking, that to think in a sort of more individualized, and to think that hay fever may have all kinds of manifestations, different kinds of manifestations that are individual to that person. Um, Next thing uh, is homeopathic remedies are natural. When I say natural, though, some people get confused with herbal medicine, and homeopathy is not. Homeopathy uses many different plants, but we don't just use plants, and we use some quite unusual remedies, which we'll sort of come to. So we do use things like sort of poisonous substances like arsenic or snake venoms, for example, are the sort of the ones that the skeptics love to sort of bash us with. How what kind of medicine is this that you're giving sort of poisonous substances to people? But they are in highly diluted forms. I mean, when I say highly diluted, so they're diluted so that there's statistically, to the point where there's statistically not a single molecule of the substance in the remedy. So actually, what we're giving someone is almost like the essence of that remedy. So if we're giving someone like pulsatilla, nice, well-known plant remedy, we're giving them the essence of pulsatilla. Really, we're not actually giving them a sort of the actual plant itself. We're giving them a sort of like a shadow or an essence of that remedy. If you can just turn off your cameras, please, and your audio, it'll be very helpful, because then it's a bit distracting otherwise. Okay, I have to do that for you. Okay. So we've the other thing that's very important to mention is that we use a holistic approach. In other words, we do take into account not just the physical symptoms, but the mental and emotional uh, aspects that go along with those symptoms. So one person might get hay fever and they become very irritable, for example, and another person might get hay fever and become very tearful and very weepy, for example, and very sort of passive. And that would need they would most likely need different remedies. And what we're trying to is work with the body, work with the person. We're trying to stimulate the body's own ability to heal itself. Um, we're also trying to not just treat the symptoms currently, but we're also trying to strengthen the immune system and the the tendency to be very sensitive. So we're trying to get to the root cause to actually help the person be not allergic in the future. And that, just to say, that can take a little time. That's not what we're going to be treating here. We're going to be treating more of the acute hay fever. But it is possible to actually get rid of the tendency to this the allergic tendency. That normally means, coming to someone like me and being treated on a more chronic basis and be treated more, so a little bit deeper than what we're looking at today. So homeopathy is great for both acute treatment and also chronic illness as well, which is wonderful. It is safe for all ages, so we can give it to babies, we can give it to children, we can give it to the elderly, and it's gentle, and it can be used, if you're taking conventional treatments, you can also take homeopathy, and it's completely safe from that point of view. So, what's not to like, really? The choice, I'm going to emphasize it again, the choice of the remedy depends on the individual characteristics of the case. So okay. So this is what we're talking about here is acute hay fever treatment. As I said, we're not looking at the more chronic aspect. So we're not necessarily looking at to rid the person of the tendency to hay fever each year, but we're trying to ameliorate and alleviate the acute symptoms. So yeah, it says acute hay fever refers to sudden, short-term episodes of allergy symptoms occurring in response to specific triggers, such as pollen bursts or weather changes, for example. And it's a seasonal thing typically. Um, and what we're looking for is immediate relief. A good remedy will normally work very, very quickly. You will not be in any doubt. And I've got a nice case which I'll mention a little bit when we go into the remedies themselves. But it can be very, the wonderful thing about homeopathy is it can be very convincing to a skeptic. Acute treatment. If somebody's in a lot of pain and the pain disappears very quickly, or if somebody's in has a terrible fluey cold or whatever, and the symptoms just disappear within half an hour, it's difficult to argue that it's a placebo effect, especially if they're skeptical in the first place. And I've seen that a number of times. So homeopathy can be a great way to convince the skeptic, especially when they're in pain or I've got very acute symptoms which are very uncomfortable. So remedies focus on it should relieve nasal congestion, the sneezing, the itchy eyes, and the other acute symptoms quite quickly. And they're used in just a short duration. Not they're not used on a long-term period. I would advise against giving remedies on a long-term basis, any remedy really. Um, so yeah, if you can turn off, I'm going to have to turn off your camera. Okay. So um, yeah, if you give a remedy and you feel that it's you give a remedy to a member of your family, and you get maybe you'll get an amelioration of the symptoms, but it comes back very quickly. Maybe it comes back maybe within an hour, and so you repeat the remedy, and then maybe it goes away for even less for 10 minutes, and then you give it again, and then and there's sort of diminishing returns basically. That means that it's probably not the right remedy. It's maybe partially indicated, partially matches the symptoms, but is not the remedy. There's what we call the simillimum, which is the kind of bullseye remedy that's kind of really, yeah, hits the bullseye and causes a sort of a deeper effect. So, so this is, I just want to say about something about chronic hay fever treatment. So if you come to see me and for your hay fever treatment, um, and chronic hay fever involves prolonged or recurring allergic symptoms, normally persist over a long period, and often, yeah, across years, many years. Often, people often come with, for example, oh, I get every winter I get a tonsillitis, or yeah, every summer I get hay fever. And so, what is our approach? So we need to assess the person's the individual health and the lifestyle and the always looking for the underlying causes. Today I was writing a Facebook post, and somebody says, "Oh, you did some good detective work there." And I said, "Well, being a homeopath is a bit like being a detective. We're always a little bit not suspicious, but we're always looking below the surface, I suppose, to see what are the causes, rather than just taking things at face value." Remedies are chosen to strengthen the individual's overall constitution. And that will, when I say constitution, that will be both mental, emotional, and physical symptoms, aiming to reduce the frequency and severity of allergic reactions. And it's about long-term management. It focuses on long-term relief, prevention, and generally sort of boosting the person's immune system, their ability to recover, their sort of strength, their robustness in everyday life, and to be not so sensitive to these little grains of pollen. Obviously, not everyone gets hay fever, so we have the ability to just not be. It's not just that yeah, the pollen affects everybody. It doesn't. So we have to look at the people that don't get it and say, well, what have they got that perhaps the people that do get the hay fever don't have? Okay. So there are some kind of cover-all remedies which you might want to experiment with. For example, you can get a remedy called tree pollen 30C. 30C is the strength of the remedy. You can get homeopathic remedies in different strengths, and the lower the number, the lower the strength. The higher the number, the higher the strength. It actually relates to the amount of dilution and sort of preparation at each dilution. So actually, the higher the number, the more dilute it is, and yet strangely, the deeper the remedy works, the higher the number. Um, we tend to use, just for acute hay fever, we would tend to use a 30C remedy or a 6C remedy. So we wouldn't go higher than that normally. And so if you've got a first aid kit, they would tend to be a homeopathic first aid kit. It'll be normally a six. They will have sixes or 30s in there. And I would advise buying yourself a homeopathic first aid kit. You can buy them from the homeopathic pharmacies. So Helios, I've mentioned Helios here, Helios Pharmacy. Their website is helios.co.uk. Let me put that in the chat box. And on their website, you'll see some really good first aid kits. There's ones that with a 18, normally it's 18 remedies and I think 36 remedies. And yeah, whatever you can afford really. If you can have the 36, then that's obviously better. But if not, start off with the 18. And it's a really good investment to have a homeopathic first aid kit. So yeah, we've got tree pollen, which would normally be, it's normally the trees that come in the in from March to May. Later on, so we might have the mixed grasses in from May to what do we say, July. So that's worth trying, but they don't always work. If you those sort of coverall, it's a little bit like taking a conventional approach. It can work, but sometimes it doesn't. So we're going to explore now some individual remedies that are more, and also it's maybe a little bit more fun to individualize your family and sort of work out. It's good for your brain, good for you to become a better homeopath, is to sort of work out the remedy on an individual basis. So our first remedy is the lovely onion. Look at those lovely onions. Allium cepa. Um, Before we go into that, are there any questions? Feel free to unmute yourself if you've got any questions, or if you just want to, I don't know, say hi. If you don't, then if no one's coming forward, I'll just assume it's all okay and you all understand it and that there's no problem. Good, good, good. All right, so let's have a look at Allium cepa. So, well, if you know about the effects the onion has, if you're cooking with onions, you know that what it causes is similar. It causes symptoms similar to hay fever, sort of the red eyes, the watery eyes, like teary nose, running nose, and it's very similar to a sort of hay fever reaction. So it's not surprising that, because we know that homeopathic remedies work on the basis that like cures like. So we're always giving something that could cause the symptoms we're trying to cure, but in a sort of homeopathically prepared dose. Um, so um, what kind of symptoms are we looking at to be able to prescribe Allium cepa? So we're looking for a profuse watery nasal discharge with sneezing. It can, if the person complains of sort of burning of the nose or the upper lip or rawness around the nose, that can be a sign for Allium cepa. Head feels dull and bunged up. There may be itching in the nose or the back of the throat or the roof of the mouth. Eyes tend to be red, sensitive to light, and the tears burn typically. And they tend to be, they want to often be outside in the open. They want the cool air. So again, this is individualizing the symptoms to um, so some people might want to stay inside, but other people say, "Oh no, I need fresh air. I need the window open, or I need to go outside." And I need some people even need to be fanned, for example. They need a fan, and so these are the sort of specific symptoms that we need to look for when we're prescribing. Arsenicum. So this is often surprising, um, you know, to people that think homeopathy is basically witchcraft, or it's they're very skeptical to when we say we give arsenic, that causes a lot of raised eyebrows. So with arsenicum, there's actually even more sort of burning. There's often quite pronounced burning of the eyes and the nose. Again, a constantly running acrid. See, sometimes the symptoms can be a little bit similar. With arsenicum, we tend to notice the person is very anxious. They often are very insecure people, or they become very insecure with any kind of symptom. They feel they're going to die, or they feel they're very ill. It's a good one. It's one of the remedies for man flu. You know, guys, we're often the worst patients. We often think we're going to die if we have a slight cold or a flu. So arsenicum is one of those remedies that works on that. And the if you give the arsenicum to this person who's very fearful, often the first thing you'll notice is they feel calmer in themselves, and then you know you're on. So this is sometimes when you give a good remedy, you may not even see a change to the physical symptoms initially, like within a short space of time, but the feeling is you get a feeling that they seem calmer, they seem happier, the panic has gone, and then the physical symptoms start to get better as well. There's a lot of sneezing, and this doesn't give any relief, so they keep sneezing so repeatedly. Hay asthma. So this is an extreme form of hay fever when you get asthma where there's short of breath as well. Most of the time you don't see that, but occasionally you do. And arsenicum is one of the symptoms, one of the remedies to really consider in case of hay asthma. We'll look at a few more remedies a little bit later. They tend to be quite chilly people, or very chilly even. So they'll want to be indoors. They don't want to go outdoors. They tend to be worse. They'll say they're better sitting up in bed, for example. They're worse from lying down. So these are all kind of individual symptoms that you'd use to decide whether to give arsenicum. Euphrasia is another sort of popular homeopathic remedy for hay fever and has a particular, it's called eyebright. That's the common name for euphrasia. I think, does it look like? Yeah, it's because it's always been for hundreds, maybe thousands of years. It's been known to be like Optrex for the eyes. So it's often been used as a sort of a tincture to sort of clear the eyes or to reduce irritation. So with the homeopathic remedy, you often uh, see the watery tears, and the tears tend to be acrid, but the nasal discharge is not acrid. So you don't tend to see the redness around the nose so much, or the burning, that sort of idea. The eyes water, the person may say, "Oh, when the wind blows, or sunlight, that's when I the eyes water." And another interesting symptom is that the nose runs during the day, but is blocked at night. And you've probably heard of people that, so you probably know people that's the case. So euphrasia might be a good one to remember in that case. The mental symptoms aren't so prominent with euphrasia, so in at least for acute prescribing. Um, so you have to go more on the physicals for euphrasia. Sabadilla from the lily family. Um, and they, these people, yeah, you got loud sneezing. Again, a lot of watery discharge, so typical of hay fever, itching and tingling in the nose, um, dry mouth but thirsty. There's a lot of contradictions in Sabadilla. So they tend to be very anxious. They can even look like a bit like an arsenicum. They tend to be quite anxious. And a bit obsessed maybe with their state, and maybe they have a dry mouth but they're thirstless. That seems to like be a contradiction. Um, and the symptoms can be worse even just thinking about them. So if they can just distract themselves, they may say they feel better. Um, and sometimes you can give a combination. There's a popular combination which is allium cepa, euphrasia, and sabadilla is a popular combination. Again, to sort of try and cover, especially if you're not experienced and you need a little bit of help, that can sort of be a cover-all, and sort of it's that's worth a try. If you're not sure which one to give, you can mix remedies like that in acute prescribing. So sabadilla. Waiithia looks like a sunflower, little mini sunflower, and it is in the sunflower family. And with Waiithia, yeah, they tend to get depressed with hay fever. They feel they haven't got any friends, or they feel lonely, or they feel not supported. Um, And the characteristic of Wieithia is a pronounced itching on the soft palate. So if I see that symptom in a person, my mind goes straight to Wieithia. They also kind of easy sweating and also constant swallowing as well in order to clear the throat. So Wieithia is a quite interesting one, but if you see that itching of the soft palate, and again they want to scratch it with a tongue, then I think Wieithia is a good candidate.
Can I ask a question?
Yeah.
So, Wieithia, it's something I've noticed. I have a itch on the soft palate, but if you don't match the mental symptoms, does that? But you have a very strong itching on your palate.
There are other remedies that have that. It has to
Oh,
be.
okay.
I'm giving you the sort of like the headline remedies.
Yeah. Okay.
But it's worth a try. If
Yeah.
you're suffering from hay fever, I mean, it is definitely worth a try anyway. It's not going to hurt you. Take one dose and see how you feel. And it could just be the remedy. That is quite a strongly characteristic symptom.
Okay.
So
Thank
yeah, worth a try. What have we got next? Ambrosia. Again, this is from the sunflower and arnica family. Um, these are the kind of plants that you see at the side of the road. They sort of grow almost as weeds. Um, I actually took this. I found this very, very good for I had a not hay fever, but I had a bad cold. And I found ambrosia was excellent. It really just it cleared it up. I had all of it, itchy eyes, itchy throat and ears. I had a bad cough. This is one is worse in the autumn. Um, Nasal congestion alternating with a runny nose, very repeated, very acute and very violent sneezing episodes repeated. You can think of ambrosia. It's often ambrosia is one of those that you may come to. You've tried maybe a couple of remedies. You come to ambrosia. You think, well, let's give ambrosia a try. Sometimes I'm not going to pretend. Sometimes it's tricky to identify, especially without experience, to identify the remedy you need with hay fever. The good thing is you can't really do unless you were very silly, and was giving 100 tablets a day or something like that. Then you're not going to really do any harm, and you could do some real good. The best thing is to give a dose, give one tablet to the person, and see how they respond. So always assess the the reaction of the patient. You're always like you need to because you may need to adjust and adapt the dosage accordingly. Some people need maybe it's quite with things like hay fever. It's quite common to give maybe a dose every 4 hours for a few doses. And by then, you should see a difference. If that's the right remedy, you should really see a difference within, I mean, I would say within an hour, you should see a difference. If you don't see any difference within an hour, then it's probably not the right remedy. And you can repeat it maybe once every 4 hours, but don't give it long term. Give it for a few doses and then reassess. That's the best way of dealing with it. Nux vomica is very popular remedies, and not just use. Obviously, all these remedies are not just used for hay fever. In homeopathy, one remedy can be used in all kinds of different disease states. So, nux vomica is often used for indigestion. It's used for headaches and hangovers and all kinds of things. But the bottom line in nux vomica is often an irritable temperament. So, for somebody who's very irritable with their hay fever, and they're a bit snappish, and they are a bit hurried and impatient for a result. That could be nux vomica, and they're often chilly as well. So with nux vomica, you're looking for a stuffy nose during the day with runny nose at night. If you remember, I think it was euphrasia had the opposite. Had let's go back and have a look at that. Just just so I can reassure myself I'm not giving you false information. Yes, nose running. So in euphrasia, you've got the nose running during the day and blocked at night. And in nux vomica, you've got the stuffy nose during the day with runny nose at night. And another characteristic symptom in nux vomica is that the obstruction in the nose often alternates from side to side, and that can be a good pointer to nux vomica. They're often quite chilly. It's not absolutely necessary to see that in the person. If you've got irritability, they are sensitive though. They're sensitive to smells, and they're just very overly sensitive. Better in a warm room. They want to be kept warm often. Pulsatilla, isn't that beautiful? Lovely pulsatilla. The windflower, it's called. This is part of the ranunculaceae, the ranuncular family, and very common remedy. It's the one that everyone has in their first aid kit. And with pulsatilla, you're often looking for a yellowish green nasal discharge. That's very, whereas a lot of the other remedies, they often are a sort of just clear, runny liquid from the nose. With pulsatilla, it's often thick and it's yellowy green, so it's sort of infected. And often the symptoms are very changeable, like the person. The person is often very changeable. They are very often very weepy. They're often very, needy, is what you'd say. They seem clingy and needy, and sort of they lost all their, sort of spine really, and they seem, yeah, often it can be a little bit trying treating them because they seem so needy and clingy. But pulsatilla often will do the job and will really brace them up and make them not just the symptoms, the physical symptoms better, but actually it'll often make them feel better in themselves as well. They also want, sorry, going back to pulsatilla, they definitely want fresh air. They definitely want the windows open. So if you've got a patient that says, "Oh, I'm worse in a stuffy room," and maybe you've got the yellowish green discharge, then you're immediately thinking of pulsatilla. I've just included this. Again, this is a sort of remedy, probably more suited to people who are a little more experienced or for practitioners. But histaminum, which is histamine in a homeopathic strength. So it's not giving the drug itself, but it's giving it in a homeopathic diluted strength, can be useful for hay fever and even as a preventative remedy. They tend to be restless, irritable, and anxious. Caliiodatum is one of my favorite remedies because I had a wonderful experience with this. I used to have a Brazilian cleaning lady used to come and do my flat, and she'd only been living in the UK for a little while. She didn't speak very good English, and she came one day and she had terrible hay fever, like all the classic symptoms. The eyes were red, the very puffy around the eyes, sort of sinusy, sort of blocked nose and sinuses, and sneezing, and she had no energy. And she could just was dragging herself around, and so I asked her. She never experienced homeopathy before, but I asked her whether she'd like to try a remedy. And she was like, "Oh, well, whatever," I suppose was her reaction. She'd never come across it before. She wasn't expecting anything to really help, I suppose. So I gave her the remedy I gave her was Caliiodatum, and she carried on cleaning that day. And half an hour later, I asked her how she was, and all the symptoms had gone completely. So she'd also had swollen glands as well. The glands around her neck were also swollen. They'd gone down. Her energy was back. The eyes were okay. The nose had stopped running. Everything was alleviated. And that was just through one dose of Caliidatum. And in fact, I gave her a little packet to take away, but in fact, when I saw her again, she had not needed to take any more doses. And it was cured for that year, as far as we could tell. So you can see sometimes you can see this wonderful amelioration very, very quickly, and it's just incredibly impressive. So it's like a bit like it can seem a bit like a sort of a magic trick, but I've got a number of experiences of where that's happened. They're often with people that have never considered homeopathy before, don't know anything about it, can be very skeptical. I mean, I had one lady, it wasn't hay fever, but she had a terrible cold with sore throat with like razor blades and glands up and no energy and dragging herself around. And I offered her a remedy, and she sort of she was actually I was staying in a hotel actually where she was the owner, and she looked to me and gave me a slightly withering look, like, to say, I've tried all the drugs and they haven't worked, so I don't think your little white pills are going to do anything. And I gave her the just one dose of, actually the remedy was mercurius. And I saw her a couple of hours later, and I said, "How are you doing?" And she just looked at me in complete amazement and said, "It's all gone. Her energy is back. The throat is not painful anymore. The glands have gone down." She was absolutely stunned by the effect of the remedy, and she became like a big advocate of homeopathy and started and even treats her pets with homeopathy when you would take them to a homeopathic vet, because she was so impressed. So yeah, it can be a good way to convince people who don't know about homeopathy. I said I'd just mention hay asthma again. So we talked about arsenicum as being a good remedy for hay asthma, and especially where there's a lot of anxiety. And obviously, when you can't breathe, this is probably the most likely remedy is arsenicum. If they're finding they're breathless, often they wake up at night and they're panicky and they're anxious and they need to sit up and they don't want to lie down, and they may they actually tend to be very chilly, but they often want the window open they want the fresh air, but they want to be wrapped up. That's often a characteristic of arsenicum. Sambucus nigra, which is the lovely elderflower. This can be a good one for suffocative attacks, especially at night. So that's worth, especially where there's a dry, croupy cough and difficulty breathing. Um, it's one that they say is good for sort of infant snuffles, where just very, very can't breathe, very snuffly. Spongia is actually the sponge that you find in the sea. Um, and again, there's pronounced asthma with a barking cough. That sort of rasping cough. That's very characteristic of spongia, and often with the asthma as well, like sawing wood. Naja tribudians is actually a snake, is the cobra snake, and we use the venom of the cobra snake, not obviously in its raw form. We prepare it homeopathically, so it takes away all the toxicity, and it's used as a healing agent then. And often a constriction in the chest, difficulty breathing, and asthmatic wheezing. So that can be a useful one in hay asthma as well. I think I'm going to move. I'm not going to talk about miasms. I don't think. I think that's so. That brings us to the sort of the close of this short um, presentation on hay fever and the homeopathic treatment. I would, for anyone who's not experienced homeopathy before, I would fully advise you to get in touch with your homeopath. You can, if you want to, you can book in with me, and we can have a little chat. Free, it's free, no obligation, and you can have all your questions answered. So you just need to book in like that. And I see people now. I see most of my patients now by on a Zoom call, so you don't even need to be present. I live in Brighton. I still see local people, but I see people all over the world now in Australia and America and Canada, and that's the wonders of technology. So, any questions?
I have a question.
Yeah.
Um, my daughter has very severe allergies, but they are all limited to her nose. And I've had a lot of homeopathic treatment with various homeopaths. She has swollen turbinates
Hmm.
and not polyps. So I had her checked by an ENT and they said it's not polyps, it's swollen turbinates. And of course, they suggested surgery and said she has a
Like a
deviated septum.
deviated septum, yeah,
Yes.
quite common.
I do not want her to have, she's never had an allopathic drug in her life. She's 15 years old. She's had these for about 3 years, but nothing seems to help her. Um, and I've taken pictures and one side, of course, is more blocked because of the deviated septum, but it's there. And so any advice, any help on that because nothing seems to, and she's always pushing. She's not a complainer. She does love to eat meat, uh, more like a Naxwamika, I would say. But I've not tried Naxwamika, but I've tried everything else. Other homeopaths have.
Has she had constitutional treatment? Has she had sort of she's been to a homeopath who's taken her case, a full case
Yes,
history? I think that's the only way you can really treat something like that. It's more a chronic aspect. It's not an acute thing, and so and it's an individual thing. I don't think. I think I have treated people with deviated septum. You can get good results, but it is a very much an individual thing. It would be good, yeah, to avoid the operation if possible. Um, but I can't give you any, I can't say I would take this remedy, because it's obviously it's a very individual thing your daughter's experiencing. But it should be possible to treat that and to get some relief. To what degree would be need to be seen, but I think it's should be possible to get some relief. Um, is is she healthy in other ways, or does she have other?
yes. And but now because of I think the breathing problem, yeah, I mean she has never really fallen in besides, having a cold, fever, but maybe once a year. She's never had any vaccinations. She's, very smart girl, not a complainer. Um, you know, uh, she's everything else, just this one problem she's got, and her periods are off, so they're very like 40 days, 45 days.
So that would be, we would go into all of that. I mean, that you need to treat the whole person. That's the thing.
But
So
I've had three very good homeopaths, and they've taken her case, and I'm into the third year, and nothing, something helps a little bit, and then it's not the right remedy.
were they experienced homeopaths?
Yes, very, very.
What in it? Where are you
I'm in
phoning?
the US. I'm in the US,
Yeah. So American homeopaths.
Yes.
Yeah. Can you
I've
tell
had
me?
I have a Roma I've had a Romanian homeopath, and it's very good. And I've had one in the Netherlands. I even Dr. Robin Murphy was treating her before he passed away. So I've had, just so many, but somehow,
Unfortunately, it's one of those things. It doesn't mean that necessarily mean that homeopathy can't help, but it does. Every homeopath, it's not like doctors where you've got recognized drugs that you've got deviated septum, right? We give you the deviated septum remedy.
right,
It's not like that, and sometimes it can be, the remedy may need. I don't know. It may be an unusual remedy. It may be just one homeopath may have a sort of better approach or a better way of understanding the case. And so just because you've had 3 homeopaths doesn't mean that, and however good they say they are, it doesn't mean that it's hopeless. It just means,
No, I understand. I mean, I'm a homeopath. I live by homeopathy too, but I don't like to treat my own family members that much.
oh,
It's not easy.
yeah. But sometimes it needs, yeah, a sort of a different kind of approach, subtle approach, or it's difficult to say. I don't know your daughter, so it's difficult to say. Um, so I can't offer you. I'd have to take a case really to see what's what, and you know. But so I would not give up though.
But do you think histamine, if I did give it to her, just because doctors are saying it's an allergic reaction that's causing the turbinates to swell up, and how often
I
should I
would
give it
say,
to her?
the trouble is that you're looking at it as a almost like a conventional approach. You're saying if I give her this, which seems to be the drug that will, then that's like the conventional. Well, I'll give her an antibiotic, or I'll give her and it's better not to think like that. That is
Well,
my
no,
view.
I'm only thinking because we've tried so many other remedies, and I'm saying
Yeah,
maybe.
but just that aspect of being desperate will prevent you from finding it. You won't be able to find the remedy. You need to hand it over to somebody who can hopefully help. I just think that you've just already said yourself, treating your family is the worst thing. It's very difficult. I've spent years treating my family, and I know, I have had some good success, but sometimes you've got to hand it over to somebody else.
Yeah, I treat my husband, he's okay, but her, I don't try to do.
All right. Well, anyway,
Will you be able to take the case?
yeah, yeah. But you can. I could, if you want to, I could. If you just want to book in for the free introduction, and then I could meet her, and perhaps have a little chat with her, and then we could fix something up.
Okay, thank you.
All right, Nemat. Take care. Bye bye.
Bye.
Okay, no. Any more questions? Any more for any more?
By the way, doctor, the chat was not enabled, so we couldn't ask questions on the chat. It said chat
Oh
was dis.
no, 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 no. Sorry about that. There's something weird about the chat. I'm sorry. I think I messed it up. So sorry about that. But anyway, we got around it. Anyway, any other questions?
Just want to say thank you very much. That was great.
Good, good, good. Glad you enjoyed it, and have a lovely summer with no hay fever, and enjoy the sun. We've got some lovely sun down here in Brighton. So I know long may it stay like that. Lovely to see you. Lovely to have you all here, and I'll be sending you a recording of this, um, in the next day or so. Take care. Bye bye.